Yeah, so the Reduce It trial was an outcome study looking at patients on a statin. About 8,200 patients were randomized to either Vascepa 4 grams or placebo and followed for 5 years. It demonstrated a 25% benefit in cardiovascular events with a p-value that was 0.000001. So a robust benefit reduced cardiovascular death, MI, and stroke significantly. So Deepak Bhatt presented data on behalf of the Reduce It investigators at this meeting looking at total events. So normally when we do cardiovascular event trials, we censor it at time to first event. So if they've had a heart attack and then they died a month later, we stop it at the heart attack. Now we looked at all events that occurred during the 5-year follow-up. So the total events were many more. There were a lot more events that occurred. Patients could have had a heart attack and then had a stroke down the road or ended up with a stent, and that would have been a second event. When you look at total events, the Vascepa therapy reduced events by 30% with a much more significant p-value. So it just shows us in a larger cohort with more patient events that we basically have a bigger effect size. So Vascepa treated longer, affected even a bit better benefit than we saw in the original data. So I think the new data just reassures us of the robustness of the original data. I think everybody was very excited about the initial Reduce It data presented at American Heart and published in the New England Journal of Medicine that showed a 25% event reduction. Now we look at more events over a longer time and we see even a larger benefit. So I think it's just very reassuring of how robust the benefit is for patients who are on Vascepa therapy. So I think we're going to look for a lot of additional data points. Obviously, it's a big cohort over a long period of time, and there'll be a lot of subgroup analyses. We know that the primary prevention group, the patients who had diabetes, benefited as much as the secondary prevention group, those who already had an event. But we need to delve into that data a little bit more and see if the events were similar. I'd like to see some of the ancillary measurements, more data on the C-reactive protein and the inflammatory markers, more data on oxidation come out. So I think we'll see a lot of subgroup analyses and pre-specified analyses coming out over the next few months.